Hi, everyone. I'm Dr. Ahir. I'm one of the pediatricians in Bothell, and I'm going to be giving a talk on starting solids. This topic is something I think is super important. I feel like starting healthy eating habits from even 6-month age onwards can really set kids up for healthy eating habits later in life. And so it's something I really emphasize when I see my patients in clinic, and I'm glad we're able to have this conversation and share it today. You will see a lot of pictures of my own child. So this is my son who's now 2.5 years old. And here he is eating what looks like a bunch of random things, but solids and obviously really enjoying food. So what age should you be thinking about starting solid foods for your baby? Majority of babies are ready for solid foods at 6 months of age. The AP recently changed their recommendations. It used to be somewhere between 4 to 6 months of age, and now they're recommending closer to 6 months of age. It doesn't mean you couldn't start a little bit earlier, but that's definitely the time frame in which to really think about doing solids. Do solids replace breast milk or formula? So solid foods until kids are 1 years old should just complement breast milk or formula. We still want their main source of nutrition to be breast milk or formula, and solids are kind of considered extra foods that they're getting. So what do you look for readiness for solids? There's a couple things I look for and that I talk to my families about. One would be good head control. So we want baby to be able to hold their head up and hold it pretty steady for the duration of whatever their meal would be. We want them to be kind of naturally opening their mouth when something, including food, is coming close to their mouth. So examples I'll give is that they're often putting everything in their mouth. So their hands are going in their mouth, their feet are going in their mouth, anything they can get their hands on ends up going into their mouth. They'll bring toys to their mouths, or they'll show when you're eating that they want to put the food in their mouth by kind of just opening their mouth and looking at your food. Also that they're sitting strong with support. So this is a picture again of my son right around 6 months where he is sitting. He does have support behind him, but you can see he's kind of maintaining his own balance and holding his head up. So you just want to see that they are maintaining their head and neck upright when they're sitting in a high chair or when they're sitting in your lap. And this doesn't mean they have to do this fully independently. They should have support. They'll be in a high chair or you'll be holding them in your lap. But we want to see that they're able to kind of maintain their posture when they're doing that. And then obviously the biggest thing is interest. So we want baby to show that they're interested in food before we're fully starting food. So watching you eat, opening their mouth, kind of tracking food as you're eating, those are all examples of a baby showing interest in solids. So when and what should you be starting? So there's no right or wrong way to do solids. I think there's traditional ways, there's kind of newer ways of thinking about eating, and all of them can play a role in how you want to start your baby on solid foods. Before 6 months of age, they just don't have as much jaw coordination and self-feeding capability. And so if you are starting a little bit earlier, that is a good time to think about doing more spoon feeding, more pureed or blended foods. And then after 6 months, kind of the newer way of thinking of eating is doing something called baby-led weaning, which is much more of a self-feeding approach where baby is doing a lot of the feeding on their own. In terms of meals, around 6 months, we want to offer solids about twice a day. And then by 9 months, we want to move to kind of like a breakfast, lunch, dinner so that they're gearing up for that schedule once they're 12 months old. So spoon feeding, this is kind of the traditional approach to feeding babies. Parent is in control. You're kind of putting food on the spoon, purees, anything liquidy, and then bringing it to baby's mouth. Foods are usually pureed or fully mashed. Positives are that it's less time consuming because you're feeding the baby yourself. You don't need to buy as many ingredients. So most of these, purees could be just single ingredient foods. There's less waste because again, you're getting most of the food into baby's mouth and then into baby's belly. I have a lot of families ask me about store-bought versus homemade, and you can see in the picture, even as a pediatrician, my son got some jarred foods. We did a lot of homemade foods as well. So I think it's more just thinking about doing a balance between some store-bought stuff, some homemade stuff. Obviously, convenience when you need it is totally fine. I think it's more just not doing an all store-bought if you can, just because some of the baby foods you have to worry about heavy metals. Baby-led weaning. So this is where baby self-feeds with their fingers from the first bites. Usually you're going to give them finger foods or mashable foods. What I usually tell parents is easy foods to think of are things that you can mash between your fingers. It means that their gums are going to be able to also mash them. Some positives for this are baby gets independence. They're in charge of how much they're eating. They're eating, they're learning to kind of stop when they feel full. They're eating similar foods to the family. They're getting textures from a much younger age, which then leads to kind of better oral motor skills or learning how to kind of move these foods around in their mouth early on. And then there's combo feeding. So combo feeding is doing kind of both. Use some spoon feeding, some self-feeding with finger foods. So it allows them to do some self-feeding. It allows you to do some feeding. Baby still gets the same practice with gross, fine, and oral motor skills. They still get a lot of different textures. And then one method that you could make spoon feeding or puree feeding a version of baby-led weaning is you actually load the spoon with the puree or whatever you're giving baby, and then you hand the spoon to the baby. So they're still doing the self-feeding part of it, but you're actually helping them get the food onto the spoon itself. So here's a picture of my son. This is like a utensil that has some ridges in it. So you can mash up some fruits and then put it on the spoon. So they're still doing the spoon into the mouth for stuff that is harder kind of to pick up on their own. So purees are smooth texture foods. Commonly, what you'll see are cereals. We get a lot of questions about cereals. Cereals are great. You don't have to start with a cereal. If you want to start with a cereal, you totally can. Cereals can help babies get used to some of the smooth texture foods because you could mix it with the breast milk they're drinking or the formula they're drinking. So there is some familiarity in terms of taste. The best options for cereals are going to be fortified cereals like oats, barley, and multigrain because they're fortified with iron. And that is kind of the point of starting solids in the first place is to give babies some extra nutrients like zinc and iron that they need. Rice cereal is one that is on the market. Rice cereal and rice in general, you have to worry a little bit more about heavy metals. And so I don't usually recommend that one quite as much as oat, barley, or a multigrain. And then purees, blended fruits or veggies. And then like I talked about earlier, store-bought in moderation is fine, but there's definitely some that you want to kind of pay closer attention to in terms of heavy metals. So here you can see my younger son eating some oatmeal and then also starting to eat some blended puree foods that we made at home. And then finger foods. So, the question I think as we're kind of thinking about this different way of feeding is, doesn't baby need teeth in order to have more finger foods? The gums are really, really powerful. And in general, they do the bulk of breaking down food. When we're thinking about eating and chewing, we actually do the majority of our chewing with our molars, which kids don't get until they're like at least a year and a half old. And so a lot of their chewing, they are in fact doing with their gums, even when they do start to get some of those first teeth. In terms of size for finger foods, so here's a picture so you can see what I'm talking about. Bigger is better. So a bigger chunk is going to allow baby to kind of hold it, grab it, and independently bring it to their mouth. And it's also going to be a lower risk of choking. Babies' airways are tiny, and so we don't want to give super tiny foods because that can obstruct their airway. They can pick up bigger chunks of food, using their palmar grasp. So they don't get this pincer grasp until about 9 months old. And so smaller pieces would be really hard for a 6-month-old to grab versus a big strip where they could just kind of grab the whole thing with their hand. In terms of size, so this is what the picture is showing. So you want it to be the length and the width of 2 adult fingers, large enough that it'll stick out from the top of their hand and from the below part of their fist. Slippery foods. So, a lot of these foods, because we're steaming, can be slippery. A lot of the fruits that are mashable are a little bit slippery. And so some kind of techniques that you can do for that is you could cut out ridges, notches. So mangoes, potato wedges, zucchini spheres, you can cut out ridges. You can get little cutters that do that for you, or you could just cut a couple notches in it so they have somewhere to grab. Another thing you could think about doing is you could actually coat them. So you could coat it with like a flour or with oats or with baby cereal, any of those types of things, breadcrumbs even, so that they have a little bit of friction. I've seen a couple ideas of giving food with like a little, probably an unused, but put a baby sock on the end of it so that they can hold the baby sock part and put it in their mouth. So an example would be like if you're giving a mango pit with a little bit of extra mango on it, you could put a little sock around the bottom part so they have that traction to kind of hold on to it. Safe food textures. So obviously when we're talking about eating, the biggest concern is choking. And so we want to do feeding in a safe way. As baby learns to chew, there's three textures that are probably the safest. Foods that are soft and easily mashed by the tongue and the palate, and that can be broken down easily. So those are the ones that thinking about kind of what you can squeeze between your two fingers. Foods that are a little bit firmer, but will start to break down into smaller pieces with a bit of sucking or gnawing. So here's a picture of my son. He's having avocado toast. And I think this was when he was maybe 7 months old. So he still had no teeth. But toast is one of those things that can break down into smaller pieces. If you're sucking on it, just your saliva is breaking it down as they get wet, it kind of breaks down. Chewing on the gums will also start to break it down. And toast is great because it's a vehicle to add other things on top of. So we put avocado on here. I would put hummus on top of it. You could put cottage cheese. It's just anything you could really put on top of toast. And so it serves as a nice vehicle for that. And then another option would be highly resistive foods. So these are unbreakable foods that baby can gnaw on, but they won't be able to break off a big chunk. So that would be like a mango pit, having a mango pit with some mango fruit still on it because they won't be able to break down a huge part of that pit. Another example would actually be like a strip of steak. So you could give baby a strip of steak and it's way too tough for their gums to actually break a piece off of. And so it will teach them the motion of bringing food to their mouth, kind of the motion of chewing a little bit, and they will get the taste, but they will not be breaking down any big pieces that could go into their mouth. So each of these textures will help advance baby's oral motor skills and increase their sensory tolerance for different types of textures in their mouth. So we have to talk about gagging versus choking. I think as you're thinking about introducing more textured foods to baby, gagging is pretty inevitable. So babies will take too big of a piece at some point. What we want parents to understand is that we want baby to kind of figure this out on their own. And so try not to intervene. Gagging is a reflex that happens that actually prevents choking. So it's a very protective mechanism. Gagging will actually cause contraction in the back of the throat, which will prevent food from going down where it's not supposed to. It forces the back of the throat to close, preventing swallowing, and then it'll cause food to come back out to the front of the mouth. And at that point, either baby will chew the food again and try again, or will spit the food out fully. These are the types of experiences that teach babies that a bite was maybe too big and kind of can help them modify further feeding. Chewing skills are things that just don't automatically happen. And so these are, while it sounds scary and we don't want to see our babies gagging, these are types of things that in the end will help them develop better chewing and safer chewing skills by having this exposure and repetitive practice to chewing a bunch of different textures and sizes of foods. So what is choking? True choking is when the airway is actually obstructed and the baby is having trouble breathing. Signs for choking is usually pretty silent. So baby is not going to be making a bunch of noises. They're usually not able to cry, can look really startled or scared, and maybe will have some high-pitched sounds. You might hear some noises when they're breathing. And then as it progresses, you can see some changes in skin color. Gagging, on the other hand, is really loud. It's like a forceful retching sound. And so that is kind of the bigger difference that you're looking at between choking and gagging. In general, like we talked about earlier, choking is very rare for babies. They have a pretty good multiple protective mechanisms in place, including gagging, which, like we said, is going to shut down the back of their throat. They also have a really large epiglottis, which kind of helps guide food into the right place. And so those things kind of help when they're eating solid foods. So how to keep baby safe when eating. The most important thing to do is to just make sure that you are super close to baby when you are offering solids. So this would not be a time to maybe just step and go to the restroom while the baby's in the high chair. We want to make sure you're really within arm's reach of baby while you're offering solid foods, purees, textures, all of the different types. You just want to be pretty close. Taking an infant CPR class is a great idea. Infant CPR is pretty easy to learn and a great skill to have so that you are able to intervene if anything were to happen. In terms of feeding position, we want baby to be seated in a support seat in a very upright position, also to help prevent choking. Kind of going back to baby-led weaning itself inherently can help with preventing choking because baby is very aware of what is going into baby's mouth and putting it there. And so allowing baby to self-feed rather than putting food in the baby's mouth also decreases the risk of choking because of that awareness that's happening. And then building these well-coordinating chewing skills will also decrease the risk of choking as your child grows. So what foods would be considered choking hazards? Basically, the way you want to think about it is if it's small, if it's round, if it's hard, or if it's really slippery, then the higher the choking risk. So if it is hard, we want to try and make food soft. And so that's where we think about doing foods that are mashable between your fingers. And if they're hard like a veggie, then the way to make it soft would be to steam it. In terms of fruits, riper options are going to be softer. So really ripe pears would probably be better than the harder part. Apples, you would want to think about steaming. Um, and then other hard things, you could kind of modify in terms of the size then. So an example would be a strawberry. If you wanted to give a 6-month-old a strawberry, probably the best way to do it is to actually give almost the whole strawberry. So it's a bigger piece that baby could hold onto and suck onto versus tiny, tiny pieces that could then lodge into their airway if they don't get to mash them. If a fruit is slippery, like we talked about, you could coat them or cut it into zigzags. The issue with slippery is if it gets quickly into the back of the mouth and it is a size that could slip into their airway before they get to actually chew it, then that could be a problem. Round fruits like grapes, blueberries, you either want to mash them or you want to cut it lengthwise. So we don't want to cut a round fruit into more rounds. So you want to cut it lengthwise so it turns into a different shape so that it won't lodge into baby's airway. And then other hard things like hard nuts, seeds, popcorn, those are things that we want to avoid. And then strips, like we talked about for starting off, is going to be the best way to safely feed baby. So foods to avoid, there's some foods that babies really should not need exposure to or should not actually have exposure to. One would be honey. Honey before the age of 12 months should be fully avoided. It increases the risk of botulism in babies, and so it's a strict avoidance until 12 months old. Sugar and fruit juices, there's just no reason for them. So fruit juices kind of get rid of all of the fiber and the pulp and a lot of the nutrients in fruits, and we want babies to get all of that. And so the juice itself is not necessarily beneficial. Same thing, sugar, there's just no benefit. And so the longer to avoid giving sugar to your baby, the less they actually develop the taste for it. And so it ends up creating a situation where you don't end up having as many struggles with salt or with sugary foods as they get older. And then obviously choking hazards like we just talked about. And then cow's milk. So cow's milk is fine for eating. Yogurt is fine, cheese is fine, but we don't want babies to start drinking cow's milk until they are 12 months old. Okay, so next thing to talk about is allergens. So introducing common allergens early and serving them often can actually help food allergies from preventing. So this is something I usually talk about at the 6-month appointment, is starting to introduce food allergies or food allergens to your baby from a younger age. So the common allergens to think about introducing, and these can be broken down in a variety of ways. I think it's helpful to talk to your pediatrician about how you should start introducing allergens, but it's nice to have it on your radar as a question. Common allergens would be peanuts, tree nuts, eggs, dairy, sesame, soy, wheat, and shellfish. And there's lots of different strategies on how to incorporate these into baby's diet, what foods would be easy to serve to get these allergens into baby's diet. And so it's a great conversation to have. A general kind of way to start them is these are the only ones that I would recommend doing one at a time. So all other solid foods, you don't have to do single ingredients. You could introduce multiple at a time, except for the allergens. So those you definitely want to do one at a time. And the repeated exposure is a really good idea. So I usually recommend doing them one at a time and picking one and doing it for 3 to 5 days in a row for one of their meals that they're having. It's nice to have that mealtime be earlier in the day just so that you have kind of more eyes on baby throughout the day in case any reactions were to develop. And then after you do this more concentrated introduction, you do want to have these foods be a regular part of their diet for the same reason, to help prevent any allergies. Okay, and then what about water? So water can be introduced after 6 months. It is not a necessity, but it is something that you could start working on after 6 months. When water is introduced, we don't want to give it in a baby bottle. We want to start giving it to baby in some version of a cup. So Open cup, straw cup are ideal. Sippy cups are fine if it's the soft spout. There's some data that shows that the harder spout can interfere with tongue placement and it just isn't as good for oral development as a soft sippy cup. So thinking about an open cup, a straw cup, or a soft sippy cup. The AAP actually suggests offering up to 8 ounces of water per day starting at 6 months. What you more often will find is they will drink it and then spit a lot of it out. And that is also totally fine because they are getting still their main source of hydration from formula or from breast milk. So here's my son drinking some water from a straw cup. And again, this was like at 6 or 7 months. And so it is something that babies can start to learn to do from a pretty young age. So in general, solids should be really fun. Expose baby to lots of different tastes, textures, smells. Family meals are one of the best way to kind of think about doing solids. It takes the stress out. It makes baby see that they're eating the same thing that you're eating. And it's going to be messy. It's really hard to embrace the mess, but just try and embrace it and just know that it's going to end up leading your baby to have just better oral and motor skills as they get older. Okay, so now we're going to open it up for any questions.
Great, thank you so much. So our first question here is, can we start baby-led weaning right away at 6 months, or should we start with a puree?
Yes, you can definitely start right away with baby-led weaning if that's the approach you want to take.
Great. Our next question is if you recommend starting like vegetables first and then sweeter foods like fruits, or if there's any recommendations around what
Yeah,
to
that's
start
a great
first.
question. There is actually no evidence that shows that giving vegetables first and then doing, or, that doing fruits first will prevent them from wanting to eat vegetables. I would think more about it as doing kind of a mix of things. And so if you're doing single ingredients, you totally could do fruits or vegetables first, and you also could kind of mix them all together as well. So there's no hard and fast evidence for that. I kind of tell parents to do what they feel like they want to do.
Great. Our next question is around allergies. So if there are food allergies that run in the family, should people consider introducing things a little bit differently, or what would you advise if there's food allergies that run in the
If
family?
there's food allergies in the family, then I definitely do think that we want to think about doing allergen introduction from a young age. Sometimes I will tell those families to just have Claritin or Zyrtec in the house, just in case baby were to have a reaction. Um, Similarly, babies with really severe eczema, sometimes we might be a little bit more cautious when we're thinking about starting allergens. Mostly like that. I mean, I still think there's a huge benefit to starting them early on, but just kind of there might be more guidance in terms of what to look for and maybe even the recommendation to have some Claritin and Zyrtec around.
Awesome, thank you. And then I think along similar guidelines, we have a family asking about dairy, if that's something that you can start right away with or that you should introduce later on.
Yes, so it is. So in terms of eating, so same thing. We still don't want baby to drink cow's milk, but dairy yogurt is totally fine to start giving early on. If the only caveat to that is if baby has a milk protein intolerance, then often we will, if mom is breastfeeding, we'll have mom start to add dairy back into her diet first to make sure baby is actually tolerating having milk added back or dairy back into mom's diet before then directly introducing dairy to the baby. If baby is on formula, then either we could try switching the formula or we could just try direct introduction of dairy. Also, somewhere between 6 to 9 months. But with just starting solids, it is fine to start yogurt right around 6 months or cheese even.
Great. Next question, a fun one here. What can we expect in terms of diapers after we start solids?
Yeah, that's a great question. I actually almost put a slide in on this. Diapers will be all over the place. So some kids will get constipated when they start solids. They're digesting something totally new. And so you might see some harder poops. Another rule is color of poop does not really matter after they start to eat solids. So a lot of times poops will be similar colors to foods they're eating. Blackberries and blueberries are pretty notorious for causing almost black looking poops that look like they could have had blood in them, but it's just the berries that they ate. You will often see chunks of food in the poop as well. That is also super normal. Baby's gut just has to kind of figure out how to digest these new things. And so the one time that we will talk a little bit more about stooling is if the baby is getting constipated, then we do want to start adding some foods into the diet that can help with constipation. And so that's definitely something I would bring up to your doctor if you're noticing that stools are starting to get more firm, because there's lots of dietary things that can really help.
Great. And then we have a family wondering about spices. So they cook with a lot of spices
Yes,
in their house. Is that okay to give baby, or should we
totally
start
fine.
with
Yes.
bland foods? Okay.
No, spices are totally fine. So the two that I would limit are salt and chili spice. So all cooking spices are totally fine. I would take out baby's portion of the food before you add salt and chili spice to your portion. As they get a little older, I am okay with pinches of salt. I think that's a little controversial, but I think a little bit of salt is okay, as in like a tiny pinch. Also okay with teeny pinches of chili to see how they do with it. But cooking spices are totally fair game.
Awesome. Great. And then this is the last question. Oh, looks like we got another one that came in. Oh, when is it okay to offer like a treat, like a sugary treat, maybe birthday
Yeah, I
cupcake?
think special occasions totally fine. You know, we don't want baby to not have anything ever. And so I think for special occasions, it's cake, obviously, totally fine. I think the way I would think about it more is the less exposure they get to sugary stuff, it really does kind of change the mapping in their tongue and it makes them not enjoy it as much. So for my patients, I always give the example of my older son, who is now 7 years old. And I had no clue what I was doing. I was an inpatient doctor at the time. And so I wasn't even doing outpatient pediatrics, but I just avoided sugar for him. And then after he was 1, I baked with honey or with maple syrup, because after 1, you can start using honey. And he is still a kid now where like he will only take a bite or two of something sugary because it overwhelms his taste buds. And so it's really nice to not have that struggle as they get older. And so I think starting these things off from a younger age, it does seem like it makes a difference.
Great. And then one last question here, which would be, how do I know that my baby is getting the nutrients that they need from their
Yeah.
foods?
So, you know, the best part about solids before they're 1 is they are getting the nutrients they need from breast milk and formula. And so that is why I say before 1, really, it should not be super stressful. It should be fun, should be exciting to introduce baby to new textures and tastes and colors and all of these things because they are getting their main source of nutrition from breast milk or formula. We will check their iron level at their 9-month appointment. And so if baby is a little bit low in iron, then your pediatrician will talk to you about focusing on foods that are slightly higher in iron. But other than that, it's kind of more thinking about them getting that from their breast milk or formula. After they're 1, things change a little bit. But before that, that's kind of the main thinking.